Now it is sectioned into two parts. If I follow an imaginary line above my diaphragm muscle will be located at my stick level. Above my stick level, okay, we will call this portion the thoracic aorta. Okay? The thoracic aorta. And the thoracic aorta. And then below my imaginary line, which I'm using with the stick here, we'd call it the abdominal aorta. So it's really two different parts of the descending aorta. The thoracic aorta and the abdominal aorta. Okay, good. Very well. Let's now turn it back around this way. And now let's work with the portions in the abdominal region. So we spent some time now with the upper portion of the aorta and the branches of the aorta. Now we'll work down here with the lower portions of the aorta. Okay? Now, one of these important branches is a very tiny little artery right here. This one right here that I'm poking at. This was called the inferior phrenic artery. Inferior phrenic will be supplying the inferior surface of the diaphragm muscle. Inferior phrenic. A little tiny one here, so you have to get in there to see it. Okay. Now, a much more important branch than that is this one right here. This is a big trunk. Big trunk. It's called the celiac trunk. You can perhaps appreciate it much easier this way. The celiac trunk. Okay? Good. Now, the celiac trunk will actually give rise to three important arteries. First, we have this one right here, this thin one right here. It loops around this way. The artery, again, this artery right here. That one is called the gastric artery. Then we have this much larger one here, thicker, larger, and longer, coming right to this organ, the spleen. So this one is the splenic artery. And then more to the, going toward the other side, we have this one right here. This is the common hepatic artery. The common hepatic artery. Okay? It's going toward the liver, as you can see. This one right here, common hepatic artery. Okay? Now, let's follow down along the abdominal aorta. The next important branch, right in here. You see this one originating right here. And it comes down this way. Okay, that's the superior mesenteric artery. Superior mesenteric artery. This is going to supply, this will supply the small intestine and the first half of the large intestine with blood supply. Next, we have over here these two important arteries come into the kidneys. This is the renal arteries. So you have one for each side. Perhaps this one is easier to see. The left renal artery coming right to the kidney. Left renal artery. That's the red one that you see here. For most of the arteries, you'll see that they will be red in color. Okay. Next branch is these important branches that come to the gonads. In the female, they would be going and supplying the ovaries. In the male, they would be supplying the testes. So because we don't know this model is male or female, we will just call them the gonadal arteries. But you would understand that they could be either ovarian artery or testicular artery. So in this case, we just call them gonadal arteries. This is one of them right here, this little thin one right here. Okay? Okay? And generally, the right gonadal artery generally originates right directly from the aorta, as you can see with the model right here, right there. The right gonadal artery. Whereas the left, many times, originates differently. The left gonadal artery sometimes originates directly from the aorta, like in this case it does, and sometimes it originates from the left renal artery. In this case, it doesn't do that, but it just originates right here. So you can see the left gonadal artery right here. So these are the gonadal arteries. Okay, good. Now, we come down a little bit further And our last major branch of the abdominal aorta, or our second last branch, is this one right here, the inferior phrenic artery. Okay, this one right here. Okay, and that inferior phrenic artery will come down this way, and it will be supplying the second half of the large intestine. So this is the inferior phrenic artery. Now, at the very end of the, at the very bottom part of the abdominal aorta, if we turn it around like this, we turn it around carefully, and you can see with this model that these little stubs sticking out, these are called lumbar arteries, the lumbar arteries. And you can see that they originate directly from the aorta, the dorsal surface of the aorta. Okay? And they will be going towards the lumbar region of your back. So you're not going to find these up here. These are different ones. Okay? These are your lumbar arteries. Okay? And then finally, the very distal portion of the abdominal aorta ends in a bifurcation like this. It splits like this and like this. These are your common iliac arteries. Your common iliac arteries. Okay. Now, the common iliac artery we will then split in the pelvis this way, forming the external iliac artery, and then this one right here would form the internal iliac artery. Okay, same thing on the left side. Common iliac, internal iliac, and external iliac artery. Now, we'll use the left side of the body here because it shows you the rest of the branches of arterial branches that supply the lower limb. Okay, so again, this was our external iliac artery, and somewhere around this level, the external iliac artery, when it reaches the inguinal ligament, okay, it converts and it's now called the femoral artery. This is your femoral artery. Your femoral artery. Okay? Now, somewhere over here at this area, if I turn this slightly around this way, the femoral artery will give off an important branch right here. This is called the deep femoral artery. The deep femoral artery. So that will be a much deeper artery. Okay? So this is your femoral artery, and this is the deep femoral artery. Now, coming down a little further, when we come down this way, the femoral artery now behind your knee, in back of your knee, we call it at this area the popliteal artery. Now that one may not be on your list, but I think it's important because the popliteal artery will give rise to the next few important branches. Number one, this one right here, is your anterior tibial artery. Your anterior tibial artery. The anterior tibial artery continues down this way, and when it reaches the dorsum of your foot, it forms the dorsalis pedis artery right here. The dorsalis pedis artery, meaning the artery of the dorsum of your foot. That's what it means in Latin, the dorsalis pedis artery. So this is your anterior tibial artery, and it comes down this way. It leads right into the dorsalis pedis artery. Now, coming back here again to behind your knee, this was the popliteal artery, and the popliteal artery comes down this way, and it splits into these two. This one right here is your posterior tibial artery. And on this side, you have the fibular, or also called peroneal artery. So you have posterior tibial and the fibular artery. And these two, here on the back of your leg, come together, and they will form an arch over here on the bottom of your foot. That arch back here is called the plantar arch.